Are you someone who has carbonated drinks every now and then? Then this video is for you to watch. Hi everyone, welcome back to my channel. So like I said in the beginning, are you someone who has a fizzy drink, who loves to have fizzy drinks or carbonated drinks every now and then? Then I think it's time that you stop doing that. Now why is that so? Recently there was a news in October that a patient from Maldives who had, for years she has been drinking, she's just 15 years old. She has been drinking carbonated drinks from childhood for so continuously that ultimately she had a problem with all her teeth, and the doctor told her that the only thing that can be done is to remove all the tooth and wear a denture. Come on, just imagine a 15-year-old girl wearing a denture. Can you believe it? Of course, she came from Maldives to India and got some sort of treatment done, which was luckily possible in her case. So do you think that can happen, that somebody who's having carbonated drinks for a long time can actually end up losing all his teeth? Of course it can happen, but the stage at which it happens, the speed at which it happens might differ for each individual. Now what is this thing with carbonated drinks? You must have seen certain advertisements where something similar to a tooth is placed inside something like Coke or Pepsi, and then you see that the color of the thing changes, the whitish thing which is similar to a tooth will start disintegrating, etc, etc. These are things which come for advertisements in terms of some toothpaste, etc. So yes, if you're actually trying this hack, take a tooth which is already removed from somebody's mouth, put it in soda or put it in any aerated drink which is having a color, especially because it will be very easy for you to notice that if you leave it in that soda for a very long time, like for some 10 to 15 days continuously, then you can see that not only that the tooth will start dissolving a bit, it will also start changing its color. So if you are a person who is having a carbonated drink on a regular basis, of course it's not like if you're keeping the tooth in that soda for 10 continuous days. That's not how it works when in case of you drinking it. You are not continuously drinking soda for 10 days, but it does happen. What you need to remember is only that maybe not in 10 days, maybe in 10 years it will definitely happen. So why does this happen? Enamel, which is the outermost layer of the tooth, which is a non-living tissue. That's the problem. Even though it's the hardest of the tissues, the enamel has a certain level of thickness when it is formed. So gradually, since you're using your tooth, anyways enamel is going to be a little bit, it's going to wear off. Along with that, if you're having a lot of carbonated drinks, it's going to accelerate the process. The enamel, once lost, it is not a living tissue and cannot be repaired. It's not going to form again like bone. If bone has a problem, the calcium is lost, a lot of calcium is lost, it can still regain it. But in case of tooth, it is very difficult and it is not going to happen once the enamel is lost. So these carbonated drinks, they have a pH which is somewhere between 2 to 4, which is very highly acidic. And this acidic pH is going to harm the enamel of your tooth. If you are not a continuous user, still it's going to harm when it becomes like a very long process. So you might be thinking that if you are not using that, let me use something like a diet soda or a diet Coke. You have certain other things like a replacement for soda which is not having so much of a pH. That's right, the pH for these things are slightly more alkaline, but it's not alkaline still. It's somewhere between 5 to 6, and the normal pH which is required for the oral cavity, the normal salivary pH, etc., is somewhere between 6 to 7. So it's more towards being a neutral pH. So these diet sodas or alternatives for these carbonated drinks, they still do have a lower pH compared to the regular ones. So even after that, it is still harmful. Along with all these harmful effects of acidity, you also have a harm that these soda or all these aerated drinks, they might be having a lot of sugar content in it. So the sugar content which is very high, especially in all the soft drinks that you have, you might have noticed, as long as you're very thirsty, you drink it and immediately after the drink is over, you will again start feeling thirsty. The sugar content present in these liquids are very high, which is going to harm your tooth. If not the acidic pH of the thing, the sugar is going to be, that the sugar is the main culprit when it comes to dental decays, and the sugar staying there and acting on the tooth is going to further increase the acidic pH. So along with the acidic pH of the drink, the sugar and its activity by the bacteria is also going to increase the pH. So the mouth is going to turn out to be like an acid bath for the tooth. This tooth will be playing in this acidic bath, and it's like you have taken the tooth and put it in an acid solution. That's what you're going to do by having a lot of carbonated drinks. Of course, the sugar-free sodas will be definitely much better than the regular soda. That's true. But these sugar contents which are present in the other ones, the bacteria, they love to have sugar. So in the process of digestion of this sugar, they are going to release a lot of acid, and there's going to be a complete loss of pH balance in your mouth. So the erosions that can happen because of this, mostly it is noticed that it's not for one single tooth, like you're consuming something, so all the tooth will be affected. So what you say is suddenly there will be a change in the tooth, sudden development of sensitivity on all tooth surfaces. Suddenly you start noticing erosions on all the surfaces of the tooth, like multiple tooth will be affected at one time. So you can imagine the discomfort that's you're going to have. Along with that, the treatment cost, you're not going to be treating one tooth. You're going to get treated for multiple erosions, which is going to even cost you higher. So the worst thing in this case is that the multiple tooth is being affected. So there's one more thing which I forgot to mention, and that is you are so afraid of having a coffee stain. But do you think these drinks which have these colors, they are not going to stain your tooth? I previously told that if you put this tooth in a Pepsi or Coke and you see this colored thing, the same thing is correct in case of all these energy drinks that you have, the red wine, the Red Bull, all these kind of things. They are ultimately going to stain your tooth. If you're being a regular user, definitely they will stain your teeth. So in order to prevent your tooth surface from all these kind of erosions, what can you do? Please stop having carbonated drinks on a regular basis. Even if you're having, please remember to swish your mouth immediately with water. Rinse your mouth thoroughly every time you drink something like that. The very next thing, not like after a very long time, it should be done immediately so that the sugar and the color, none of these things stays there, and also the pH of your mouth remains ideal for you. Along with that, one more thing that you can do is please use fluoride, like fluoride mouthwashes, fluoride toothpaste, so that fluoride is an external element which can be given in order to make your tooth harder. See, enamel, like I told, it's not going to be formed again. But the same enamel, what we can do is we can supply a little bit of minerals externally so that it can remain a little more stronger. So make sure that you use only fluoridated toothpaste and mouthwashes. Next thing that you can do is please do have regular checkups with your dentist and inform them that you have a habit of having carbonated drinks very often. In that case, they might check the status of your tooth and they might be able to help you, tell you certain things and give you some advices based on how to take care of your tooth and gums if you are a chronic drinker of carbonated drinks. Just remember that everything in moderation is okay. Of course, that it's not that you should never be having, or somebody who's having it may not have a problem also. But ultimately, these things are definitely not going to be good for you. So knowing these things, I think it's better that you try to prevent the problems that might arise because of your habit. Please do take care, have it, but take the precautions which is required. And that's all for now. Please like, share and subscribe my channel. Thank you.